my name is Lydia Kalushik and this is my audience. A lot of people have had to deal with anxiety at some point in their life. It could be for something like a job interview, or maybe they had something scary happen to them at an event, and now they have anxiety whenever they have to do or go to somewhere that's similar to that event. Anxiety is pretty common. It is a lot more than what a lot of people make it out to be, since a lot of people will go, maybe you're overreacting, or you're over-exaggerating. Think logically out of it. This is not always possible, and this is important to know because statistically, it happens to a large majority of people, and it comes with a lot of physiological and physical symptoms, as well as it can increase risks for a lot of other things. So to start off, statistically, how much people have to deal with anxiety? Statistically, 31.1% of the US population has had some kind of anxiety disorder at some point in their life. And a little over 50% of people have had moderate to severe symptoms. These moderate to severe symptoms basically means that they can't get over it. It is not something that they can easily go, well, it's not that bad, or maybe I can do this to prevent it. It's not going to be that easy. And these statistics come from the National Institute of Mental Health, which is a US Department of Health organization. And also, who is more likely to have to deal with anxiety? Well, to start off, women are 2 times more likely than men to have some kind of anxiety disorder. Pregnant women are also more likely. People who are under the age of 35 years old are also likely to deal with it, as well as anybody who has health issues. Now, this is actually quite a lot of people. So, as stated before, it's roughly 30% of US people, but we also have to deal with anxiety for people outside of the US. So this statistic could be much higher than what's made out to be in that one study. And what causes anxiety? It can be a lot of things as well. It can be something like health issues. It can also be traumatic events can cause anxiety in later life. That's what I talked in the introduction. When somebody has to deal with trauma, they may start getting more anxiety when they have to do something related or similar to the event because they are scared that it will happen to them again. And as well as it can also happen more with people who have alcohol use or do drug use. And to start off, again, is physiological symptoms. What are the symptoms? Well, the main ones that a lot of people know are, well, they get a little shy. Maybe they start stumbling on the words a little bit. They might have a harder time focusing. They might start being a little uneasy, as that says. They might start fidgeting around or doing little steps like this. It's pretty common. A lot of people know that. But aren't these a little easy to get rid of? No, turns out it is not. Another study from the National Institute of Mental Health has shown that it is very irrational thoughts, but it is not something that they can just go, okay, well, it's something that's not likely to happen. And it's especially hard when the symptoms include something like panicking. You can't get over a panic attack. Or maybe they start getting obsessive thoughts about it. They might start going through their head a lot more, going, it's gonna happen, it's gonna happen. That's not something that can easily get over when it's so intrusive, and it can cause them to be on edge. It can cause them to be really scared about these things, and it's not something that can easily be pushed away or logically thought out. And that moves on to physical symptoms. Not a lot of people know about the physical symptoms, but some of the most common ones that people kind of know about is maybe sweaty hands, or maybe their hands start getting a little cold. They might need to start warming it up a little bit. They might start getting dry mouth as they start getting scared. They can start getting tense muscles, everything in the body does not want them to move. Now that's pretty basic, right? Something that can be easily ignored. But then what happens when you start getting dizzy? What happens if you want to faint? What happens if you can't sleep properly? And not sleeping properly can also then lead into the realm of not being more anxious in your daily life, being more prone to anxiety. So it's like a double-edged sword that is going to constantly happen. You get anxious, you're not going to sleep. You're not going to sleep, you get more anxious. It's an endless cycle, and so it's a lot harder to get rid of this anxiety. They might start having increased heart rate. They might not be able to breathe as properly. They might have a really hard time with these things, and that is very hard to ignore. You can't just go, well, I guess I don't feel dizzy. I guess I don't need to pass out. I'm not thinking that logically. That's not something you can realistically do. And then the worst of all, anxiety comes with other risks. Like stated before, insomnia can be a cause of it, as found by the Cleveland Clinic. But then again, it can cause other things the National Institute of Mental Health has found. It can cause diabetes. It can cause substance abuse of alcohol, drugs. It can then cause depression. It can cause heart disease. And as stated before, people who do take alcohol or drugs are more likely to have anxiety. And having anxiety makes you more likely to do that. Again, another double-edged sword. This is not something you can easily get over. This is something that affects many people, and it is not something that I don't think a lot of people can easily get over, that a lot of people make it out to be. And as you saw in probably a lot of the slides, at the bottom it says sources. I have included a whole list of the sources that I have found that talk about these exact things I have just described. If you would like to go check them out, here's all of it. And in conclusion, anxiety is a lot more than what people make it out to be. It is something that is very hard to get over, especially when you have to deal with harsh physiological symptoms, such as intrusive thoughts, obsessive thoughts. It can cause physical symptoms such as fainting. It has risks of other disorders, and statistically, many people will go through it at least at some point in their life, and over 50% will have to have moderate to severe symptoms, meaning their symptoms can and will not be able to be ignored. So remember, treat everybody with a little bit of kindness. That is the main message I want to leave you with, is that anxiety is not something to get over. So if you see somebody being anxious, talk to them, work with them. Don't tell them they're over-exaggerating and that they can get over it. Thank you for coming to my speech. And again, this is my audience.